Right now, our nation's brightest scientific minds, most innovative companies, and leading universities are moving at unprecedented speed to deliver the COVID-19 treatments, vaccines, diagnostics, and cures we need. Now, to tell us what the private sector's role in all this is Senior Director of Health and Drug Policy at the U.S. Chamber's Global Innovation Policy Center, Kelly Anderson. Wow, that's a mouthful, Kelly. How are you doing today?
I'm doing well. How are you?
I'll tell you, I'm so glad you're here with us this morning because right now a lot of people are wondering about what is going on with COVID-related research in our community.
Yeah, well, first, thanks again for having me on. I think a lot of people are surprised to learn that the search for safe and effective treatments and vaccines for COVID-19 is really a local story. Here at the U.S. Chamber, our data shows that there's currently over 1,000 clinical trials taking place across all 50 states. And that's in big cities and in small towns. In fact, statewide, there's over 80 clinical trials happening right now in Arizona. And this research that's been happening locally has enabled the discovery of new therapeutics and vaccines for, conditions where no treatment previously existed, as was obviously the case with COVID-19. Both what we've seen in Arizona and across the country is more than 500,000 Americans have rolled up their sleeves to participate in these clinical trials. And that has been absolutely essential to delivering life-changing solutions to patients and healthcare providers across the country.
I'll tell you, we are so excited about what's going on out here. And I know some people are a little hesitant because the vaccine was developed at a record time. And people wonder, can they trust it? Is it safe? But you're saying it's okay.
Yeah, I think it's really important for people to hear that they can and should trust this vaccine. I'm somebody that's immunocompromised, so I can appreciate some of the skepticism about the vaccine. I honestly had questions for my doctor too, but I think there's two things that's important to highlight here. So, first, yes, the vaccine is new, but it wasn't developed overnight. So, the technology used in these vaccines actually dates back to the 1990s, and it's because of the policies that we have in place here in the U.S., which includes strong intellectual property protection, that has really allowed innovators to try to harness the power of mRNA technology. So again, while these vaccines were developed in record time, they're the result of decades of scientific research that we're now seeing successfully applied during the pandemic.
Yeah.
And then, second, as we've heard Dr. Fauci so aptly note, medical advances that previously took years can now take place in a fraction of that time without compromising safety. So, while we currently have 2 authorized vaccines, there's dozens more in the pipeline, all of which have followed the rigorous protocol for U.S. regulatory approval. And, the other thing that's important to note is that the safety review is ongoing. CDC and FDA are continuing to monitor the safety and efficacy of these vaccines over the longer term.
So, wow, I'll tell you, it's a lot out there, and I know a lot of people are wondering different things. Where can they go to find all the different resources and more information on what we've been talking about here?
Yeah, so we would encourage folks to go to U.S.ChamberOfCommerce, where they can see that we have a state-by-state breakdown of where clinical trials are taking place by congressional district. And we also have a list of frequently asked questions about the vaccine.
Perfect. Well, Kelly, thank you for joining us this morning. Thank you for this information. I know it's going to help a lot of people as we go forward in fighting this pandemic.
Thanks so much for having me on today.